Coronary artery disease is the most common heart disease that we see in our country. The most common complication of coronary artery disease is a heart attack.
So coronary artery disease is essentially an accumulation of cholesterol within the arteries that supply blood to your heart.
Angina is basically a term that we use to describe when patients have symptoms because there's not enough blood supply to the area of the heart supplied by that artery. So when we talk about coronary artery disease, it really is a spectrum. There are people that live a very long time and they have those plaques in their arteries, but they're stable. And we call that chronic stable angina, meaning that a patient may know that after they walk 5 blocks, they might have shortness of breath and they might have to stop, or they might have a little chest pain and they have to stop. But that's stable for them, meaning that it's gone on for years, it hasn't changed in the amount of symptoms that they have. Then there are people that have unstable angina, where the quality of that pain or the quality of those symptoms have changed. Maybe it's more frequent, maybe it's happening more days of the week, maybe it's happening more times in a day. And that's a situation where we need to take it seriously, because we need to make sure that the blockages haven't built up to a point where they need to be fixed.
Or the cholesterol ruptures and you have a blood clot causing a heart attack.
When someone has coronary artery disease, they may present in a lot of different ways. People can just have shortness of breath, out of proportion to what they used to have or what they're used to having. Somebody can have palpitations. Someone can just have a non-specific type of pressure in their chest. It doesn't necessarily need to be something that they feel is chest pain.
You don't always have to have chest pain in the center of your chest. It can occur anywhere above the waist, and sometimes it's lower down, and people think of it as a stomach ailment.
One symptom that is commonly missed that people should be aware of is a sudden decline in your exercise tolerance. Activities of daily living become more of a battle for you.
I started to get a little bit of mild pressure over here. It was so mild I just thought maybe I strained something at the gym, but it happened 3 days in a row. Didn't think much of it, but on the 4th day it happened the same time into each of my runs, maybe 10 to 12 minutes into the run. And this time it was a little different in that it actually radiated a little down the side of my arm into here. I knew I had to go to somebody.
The most common risk factors for heart disease are family history, high blood pressure, high cholesterol, obesity, cigarette smoking, lack of exercise, and diabetes.
I always tell patients, you can't control your family history, you can't control your genetics, but you can control your diabetes, you can control your weight, you can control your cholesterol. So there are many things that we actually can reverse by just changing our lifestyles and being on the right medications and having good follow-up with your doctor.